One important factor when you're having an ACL is your graft choice. So how do you determine what graft you want to use when you're making a new ACL? Basically, there are two classes. You have autograft, which is tissue from you, and you have allograft, which is tissue from a cadaver. For the most part, I do not use tissue from cadavers, only if someone has used everything in their body already. They've already used their bone, tendon, bone, their hamstrings. That's the only time I'll use cadaver tissue. My preference is always to use autograft. If you're using autograft, the options are to use quad tendon, where you take a little rectangle of bone from the top of the kneecap and about a 10 millimeter width of the quad tendon. Patellar tendon, where you take a little rectangle of bone from the patella, the central third of the patella tendon, and then a rectangle of bone from the tibia. The other thing you can do is take two accessory hamstring muscles from the inside of the leg to make a new ACL. Now this is the way I think about it. What happens? A tendon attaches a muscle to a bone. A ligament attaches bone to bone. Even though we call this the patellar tendon, it is actually a ligament, so it's already what we want it to be. Additionally, when you harvest this graft and then put it back into the body 15 minutes later, your tissue is going to heal into your body very, very quickly. So that if you have a rectangle of bone and a strip of patellar tendon and then a rectangle of bone, each of those bone blocks is going to heal into your bone very quickly. There is already a blood supply established between these little bone blocks and that patellar tendon tissue. And so for my mind, what makes an ACL work and what makes an ACL last is how much of that soft tissue turns into living tissue in your body. And in my opinion, nothing beats a bone tendon bone. Something to keep in mind. NFL doctors 10 years ago were polled as to what they used to do ACLs. About 2/3 did bone tendon bone 10 years ago. They re-polled them this year, 99% do bone tendon bone. So if this is good enough for all the professional athletes in the world, it's good enough for you.